For people with darker skin, getting diagnosed with plaque psoriasis may not be as straightforward as it is for white people. They are more likely to be misdiagnosed and may have to wait longer to get a diagnosis. These delays could result in more severe disease and complications. When you look up psoriasis online, most of the images you see are of white skin covered in scales. But the reality is that psoriasis can affect anyone, regardless of their skin color. Many dermatologists are trained using textbooks that mostly feature images of psoriasis on white skin, which means they may not be as familiar with how it can look on darker skin tones. This lack of training can lead to misdiagnosis and mistreatment for people of color with psoriasis. Some have been mistakenly treated for ringworm or eczema, while others have had their psoriasis confused with lupus skin sores or even a syphilis rash. It's not acceptable for dermatologists to miss a psoriasis diagnosis in people of color, and it's an issue that needs to be addressed. In addition to the lack of training, people of color also face barriers to accessing healthcare, which can delay their diagnosis and lead to more advanced disease when they do eventually see a doctor. This could be due to less awareness of the condition, distrust of the medical system, or a lack of health insurance. These issues can make it harder for people of color to get the care they need for their psoriasis. If psoriasis is not diagnosed promptly, it can worsen and affect your entire body. Chronic inflammation from psoriasis can also worsen other medical conditions. Additionally, receiving the wrong treatment, such as beta blockers for high blood pressure, can make psoriasis symptoms worse. Psoriasis treatment is generally the same for everyone, but there are some differences to consider for people of color. For instance, phototherapy can cause dark patches on the skin, which can be more bothersome than the psoriasis itself. People with scalp psoriasis may also have trouble with frequent shampooing to remove scales, especially if they have textured or curly hair. Biologic drugs are an important part of psoriasis treatment, but black people are less likely to be prescribed these medications than white people. This may be due to a lack of representation in ads for these medications, leading to less familiarity or belief in their effectiveness. Some patients of color may be hesitant to take injections and prefer creams, but it's important to understand that psoriasis is a systemic disease and needs to be treated from the inside out to control inflammation. To ensure you get the right treatment, it's important to see a board-certified dermatologist who specializes in medical dermatology and has experience treating psoriasis. Some dermatologists may focus more on surgery, cosmetics, or allergy testing, so it's important to find one who is experienced in treating psoriasis. If you have skin of color, it may be helpful to search for a dermatologist with experience treating skin of color. There are a few websites where you can find a dermatologist with this expertise, such as the Skin of Color Society, Black Derm Directory, the National Psoriasis Foundation, and the American Academy of Dermatology. It may be challenging to find a doctor who looks like you, as there are few dermatologists of color practicing in the United States. However, it's more important to find a care provider who is comfortable treating patients of color and respects your beliefs and cultural identity.